It's Local Edition. I'm Brad Pomerantz. Thank you so much for joining us again. Our guest is Dr. Craig April. You see him on Obsessed, produced by Tijuana Entertainment on the A&E network, Mondays at 10 p.m. It's quite a remarkable show. It's about individuals suffering with obsessive compulsive disorder. Doctor, thanks for joining us.
Thanks for having me.
What exactly is OCD?
OCD is a neurobiological condition marked by obsessions and compulsions. And obsessions are these dark, unwanted thoughts, images, and impulses that are recurring and cause a lot of suffering. And then the compulsions are the behaviors that are designed or created to reduce the anxiety, but unfortunately they actually increase and maintain it.
Explain.
Yeah.
Why is that?
Well, it creates a certain kind of cycle. So what happens is when you avoid anxiety, and this goes for everyone, but especially for those with OCD, when you avoid anxiety and engage in a compulsive behavior, it teaches the brain that the only way to cope with the anxiety is to escape.
And so the bottom line is, and what we see on Obsessed, is you work with these patients and engage in a strategy called cognitive behavioral therapy.
Correct. And
it's literally you are exposing them to their fears. Is that right?
That's exactly right.
So give us an example. Tell us about William or Nancy, who's on an episode that aired on July 19th.
That's right. Well, William had a fear of odd numbers. That was his overriding obsession. He had some others in terms of fear of contamination, but his overriding obsession was a fear of odd numbers.
Oh,
and the fear was that if he was around an odd number, that harm would come to him or his family, and so he engaged in a lot of avoidance. And the avoidance behavior, which was a compulsion, was counting, and he was counting even numbers. And you can imagine how debilitating that can be, because you can count anything. It was in his home, out of the home, really everywhere he went, he was counting even numbers to avoid odd numbers.
Oh, God.
And it completely disrupted his entire life.
And how are you able to help William?
Well, the key is cognitive behavioral therapy.
So you make him count odd numbers? I mean, is that in the simplest sense?
Sort of, yeah. I mean, it's exposure, and so the exposure is gradual exposure to what the feared stimulus is. And so for William, gradually helping him face odd numbers. And so giving him homework assignment where he would count odd numbers on purpose rather than engaging in avoidance and counting even, really focusing on all odd numbers. And
let's talk about OCD and the risk factors for it. I understand that certain populations are more at risk than others. Relatively speaking, give us a sense.
Well, that's actually not really true. It's interesting. OCD is a neurobiological condition, as I said, and it can affect any culture, and that's the fascinating thing about OCD.
What about in terms of gender?
It's very neutral. It's gender neutral.
Not
I see
boys?
as many men as I do women.
I thought boys were a little more at risk. No, I could be wrong.
That's not true. Yeah,
okay.
It's an equal opportunity syndrome.
So, what do you do? If you're a family member and you see someone that you think may be engaging in OCD behaviors, what can you do?
Yeah.
I mean, when does it go from just a family member being goofy to they've crossed over?
Yeah. Well, it goes from just sort of struggling with neuroses to a full-blown
Los
syndrome.
Angeles.
Well,
I mean,
that's
we all
right.
struggle
Who
with
isn't
neuroses,
neurotic, right?
Right. Honestly.
But when it's OCD, it can really disrupt a life. And so if it's interfering with relationships and work and just daily life, then that's when we know there's a problem and it needs to be treated.
And less than that, would that be just generalized anxiety? I mean, give us a sense of the levels.
Well, with OCD, again, the hallmark are these obsessions and compulsions. So if those aren't present and there's just general anxiety, then it could be generalized anxiety. But there are also panic attacks. It could lead to a panic disorder. And there are a host of phobias.
I got to say, the show, while entertaining as a viewer, I think is important as well. And I really do think it sheds light on a very quiet illness, and I'm glad you're involved in it, so we thank you for that.
Thanks.
The show airs on Mondays at 10 p.m. on A&E. It's called Obsessed. I'm Brad Pomerantz. Back to HLN.
Why settle for being stuck in just one room? Enjoy the internet from anywhere in the house with Charter Wireless Home Networking.